from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back into Daybreak. It's Wellness Wednesday. A question we'll be talking about today: is it possible to have a non-surgical way to replace a heart valve? Well, here today to explain all that, Baptist Health cardiologist Dr. Anthony Fletcher. Dr. Fletcher, as always, good morning to you. Thank you for coming in this morning.
Good morning.
This is something that is pretty interesting. We have a diagram up here. We're going to talk about that in a minute because this is the procedure, how to fix it. But let's talk about the possibilities of something like this. Technology is making this more possible for patients out there.
Absolutely. This is a fantastic time in medicine. You know, with advances in technology and techniques, we now have the ability to fix aortic valve disease or other valves that we're currently under way in terms of working with. But the one we're talking about this morning is the transcutaneous repair of the aortic valve.
Okay. And the aortic stenosis, what are the symptoms of something like that would require this type of surgery?
Absolutely. Aortic stenosis is a valvular problem that's more common as we get older, although you can get it at birth. But as we get older, especially in the 70s and 80s, that valve becomes calcified and thickened. And by that, with that, the valve has a decreased amount of opening.
Okay.
And because there's an increased amount of resistance to flow, the heart has to work harder. And as a result of that, the heart can become thickened, and over time it can become weakened. And this leads to the development of symptoms that result in that aortic stenosis.
What are those symptoms exactly? What should people be watching out for?
Well, the symptoms, again, this is something that starts early in life and progresses, but once symptomatology becomes present, the patient may feel dizziness, they may have faintness or near blackout spells.
Okay.
They can have chest discomfort, shortness of breath with activity, and they can have palpitations or irregular heartbeats.
All right, let's talk about the procedure itself and exactly what are we looking at here? What do you guys do to make this happen?
Actually, this is a diagram of the heart with the heart being here. This is the left ventricle.
Okay.
This cane-shaped artery is the aorta itself, and here we actually see the catheter in place. The aortic valve would sit here, and actually this depiction is kind of farther along in the procedure, but initially the wire comes up and around, comes across that valve, and then initially a balloon comes where the valve would be calcified and narrowed here, and the balloon dilates that artery first. Then secondly, the valve itself is brought up and placed, and that valve inflates, just like a person might get a stent. The valve inflates and crushes the old valve there and seals that valve up against the wall of the aorta. And now this valve essentially is a functional valve, replacing that old calcified valve, allowing the heart now to empty very easily and with less stress. And over time, we have some improvement, perhaps, in the function of the heart muscle itself.
Unbelievable technology, just continuing to find ways to better life and make surgery easier for you guys as well.
In this case, I'll state, this really isn't surgery. This is a procedure.
Procedure, that's right, non-surgical.
It's done by either access from an artery in the groin or one of the major arteries of the body, or on occasion, a small incision is made in the chest to place this. But in most cases, especially if we do it from the groin, the patient goes home the following day. So that's a beautiful thing.
That is a quick trip to the hospital.
Absolutely.
And hopefully it always is for folks out there who aren't feeling well. There's a look at the Baptist Health line if you want to call and schedule an appointment today. Dr. Fletcher, as always, thank you for coming in. We'll see you next time.